Actually, the question there is,
Okay.
since we're talking about the budget in Congress now, no? So what do you
Yeah.
suggest, for example, in terms of realigning budgets so that more monies go to especially the provincial LGUs?
Yeah. The budget for health is fourth, in the list of priorities. I
Right.
think now, given the challenges we are expected to meet as we open up the economy, surges and the like, we need to put more budget into building hospitals, getting more health workers, hiring more health workers. We need to get more budget for research on COVID. We need to get more budget to empower LGUs. I think that's the key for me, and where the budget is as far as the health sector is concerned, it's priority number 4 or 5. Still more budget is going to build, which I think is part of the strategy of our economic team to jumpstart the economy. But I feel more money should be allocated for building capacity. The surge is going to come. This COVID-19 pandemic is going to be here for at least a year more, and we need to prepare for that surge. Yeah, it's budget season, and I think it's high time that we elevate the conversation about healthcare capacity. And that's not, and Father is correct, it's not just about beds and ventilators. It's really about people. It's about healthcare workers. We cannot deal with the surge at the moment. Okay, it's very clear. Okay, and this is a position that's shared by even the members of government that I talk to. Right now, we need to scale it up, and then while we are in this downward trend that we're trying to sustain, this scaling up has to happen. But there's a big conversation now emerging in government. The key problem for some, a minority of thinkers in government, is that the local government code, the decentralized setup we have, has created a challenge as far as healthcare is concerned. And there is a call for decentralization of healthcare. It's a serious discussion that I think that merits a significant debate. The pandemic has exposed the problems of providing healthcare in the country, and some people are suggesting the challenge is because at the provincial level, that's where DOH ends. When below that, the DOH has a problem already. So, you cannot have standardized ways of dealing with things because you have so many of these veto constituencies at the local government level. And a lot of them have a different view about how to use their healthcare systems. And guys, it's a real problem, the politics of it. It's true. Pandemics are here to stay, no? And it's a challenge for humanity. But bad governance really exacerbates pandemics. And, I would like to talk about the details that I'm hearing from different local government units, no? About governors fighting mayors, about the lack of coordination as far as the use of healthcare facilities. It's a real problem here in this country. And a lot of the surges we've seen over the past 2 months have been exacerbated by the failure of governance in these local settings. The failure
Mm.
of politicians and political families to go above
Fred,
their trivial parochial politics and to deal
yeah,
with the
Prof,
pandemic in an effective
Prof,
sense.